Thank the gentleman from Maryland, and unless any of your Democrat colleagues want to comment, I'm going to open it up for any member that would like to claim time in opposition.
Chairman, I claim time in opposition.
Mr. Blake Moore from Utah, I yield 5 minutes.
Thank you, Chairman. Some of the other members. Chairman, I think you and I know each other for a few years, feels like many. You know that I have a problem with candor and sometimes being a little too much so. What we're doing here, this exercise right now, and particularly with the last amendment, but probably all of them, to force a vote so then we can do political attack ads. And you know what? Our party's, guilty of it too. If we truly want to deal with the last one was named Protect Social Security Benefits and Solvency, let's come together. When we offered a bipartisan debt commission, and it was and there was a handful of really close, good friends of mine on the Democratic side willing to support that. I think we'll get a bunch more when we get it to the House floor. I encourage others, and to my colleague and my friend from Maryland, we've talked about a lot of those same issues. I think there's more there that we can do in a productive way than put out the amendments, force the vote, and then all of a sudden, you see some attack ads going to the more vulnerable districts. Again, sorry for being too candid on how we operate here, but we can do better. We can do better than this. Drug costs are a hugely important thing too, and so I'm going to speak to this amendment a little bit and share some. And I also another game that's played back in Washington is when the majority creates a bill, then the minority will usually come up with a counter name to it. They're usually pretty funny. There is one that I did end up liking a lot. I don't overly use them, but when the Inflation Reduction came out, we came up with the same sort of name-calling bill in response of Innovation Reduction Act. And while those are gimmicky, I will admit, I do want to hit the point of when we go after these big government price controls, we are limiting the ability for the industry to create more cures. There's one particular really strong piece of information that I wanted to share. I'm just going to read it. The CBO has acknowledged that innovative new drugs hold the power to significantly reduce health spending, particularly by addressing chronic diseases, which are a huge cost to the U.S. healthcare system. I have toured multiple different Bio Utah and BioHive. There are these two organizations in my home state that are heavily focused on creating the innovation needed to be able to tackle our biggest health issues. Drugs that are related to some of the most costly issues, from obesity to diabetes to heart failure. These are the things that are driving up our costs significantly. A good friend, on the Ways and Means Committee with me, Mr. Schweikert from Arizona, he says it better than anybody. Everything we're doing in healthcare-related policy right now is having just another group finance it. And that's what I view the Innovation Reduction Act to have done, was, okay, so we're gonna cap this, and then we're gonna force another group to. Nobody is actually solving true healthcare costs. And what I believe this amendment will do, what we're trying to do in the healthcare world is add transparency, add competition, things that drive every other market that we exist in, that we, in bipartisan agreement, agree is necessary for the private market to exist. But for some reason, healthcare is like, we can't provide patient choice. We can't provide that transparency. So a patient, an outpatient, not even talking when you're in an emergency, can choose, oh, that x-ray is X dollars, this x-ray is Y dollars. I should be able to choose this provider over this thing. We just want to create that and actually lower healthcare costs. What we're doing here arbitrarily limits our ability to go after cures and to go after true healthcare expenditures. You've seen the what point? An analysis from the nonpartisan Congressional Budget Office concluded that the IRA will lead to fewer medicines reaching patients. Independent analysis from leading economists, including from the University of Chicago, has forecasted the IRA will lead to over 100 fewer cures and therapies reaching patients. And as my time expires here, I want to make sure that I request unanimous consent. The point is, we need to go after cures. American innovation leads the charge here, and we need to maintain that is what we have here in the U.S. Chairman, I ask unanimous consent to submit a letter from CBO to Senator Whitehouse acknowledging innovation prescription drugs that have reduced federal health care spending into the record.
Without objection, so ordered.
Thank you, and I yield back.
Time has expired, and we will yield now a minute to our friend from Maryland for closing comments. It will take a magic minute if you want and be a little generous.
Oh, that'd be great, Mr. Chairman. I just would respond to my colleague that
Minute to our friend from Maryland for closing comments. It will take a magic minute if you want and be a little generous.
Oh, that'd be great, Mr. Chairman. I just would respond to my colleague that thank God he's not running my business. Thank God. Because he likes the idea of having not be able to negotiate for anything he buys. Everything he buys, he's happy to have the price from the supplier, Big Pharma, just give him the price and accept it and say, that's all good. How good is that? Well, that's not good. Big Pharma makes more as a percentage of sales than even the software companies do. Big Pharma is gouging Americans. Talk to a Big Pharma corporate executive. Talk to a CEO. I have, and they'll tell you 3 times more than what we pay because countries like France say, give us a better price or we're not going to carry your damn drug. We'll carry another drug that does the same damn thing. But we're here supporting, you are supporting Big Pharma. You're taking their money, you're taking their pay, you're taking their donations, you're taking their PAC money, and it's no wonder you don't want to do anything to upset Big Pharma. That's all you are, a tool of Big Pharma, and it's ridiculous, and we're tired of it. So get with the program and support the American consumers. Thank you.
I thank the gentleman from Maryland.